Hi, everybody. Dr. Julie McLaughlin here from Begin with Wellness. I'm super excited to be talking to you today about the top 12 supplements to optimize musculoskeletal health. Now, you know, as a chiropractor, I know a lot about musculoskeletal health, and we're going to go through some of the supplements that I've recommended to my patients for their joint pain, their muscle pain, just inflammation overall. So let's get started. I have a little PowerPoint to share with you. So as a chiropractor and a functional medicine practitioner, this is a great combination. And I'm going to make it super, super simple because I'm going to give you lots of choices, 12 choices to be exact. And I'm going to give you a place where you can order pharmaceutical grade supplements. So as we go through, make a list of the things that kind of interest you that you might be wanting to utilize to help with some of that pain. So number one, glucosamine and chondroitin. This is a great supplement for osteoarthritis. However, if you have rheumatoid arthritis, which is an autoimmune type of arthritis, you don't want to use this. Glucosamine and chondroitin many times come combined, and that's when it's utilized the best, is in a combined supplement. So the dosing of the glucosamine is going to be about 1,500 milligrams a day. And on the chondroitin, it can be 800 to 1,200 milligrams. You can take them separately, but I would recommend taking them together in one pill. Number two, the omega-3 fatty acids. This is fish oil, right? Fish oil have great anti-inflammatory properties, and it can help reduce joint pain and inflammation. The dosing on this is going to be between 1,000 and 2,000 milligrams per day. We know fish oil is great for other things like heart disease, brain health, but it's also great for inflammation. So you'll get a 2-for-1 benefit on this fish oil. Now, calcium. Calcium is a great nutrient. And it used to be we really wanted to have a lot of calcium, especially in postmenopausal women, but not so much anymore. You want to be careful. You don't want any more than 500 milligrams of calcium per day. And that includes supplements and what you're getting through your diet, because they found recently that calcium causes hardening of the arteries. So taking too much calcium can be a detriment. So I recommend you just get your calcium through the foods that you're eating. And that's going to help support your bone density. And we're going to talk a little bit more about how to increase that bone density with some other supplements as well. So if you're looking to order pharmaceutical grade supplements, I can help you out, because you don't want to be buying them at the grocery store or at the retail store, because they're not that pharmaceutical grade. So if you look on my website, drjuliemclaughlin.com/supplements, you'll be able to see where you can order these pharmaceutical grade supplements from Zymogen whole scripts or full scripts or pure encapsulation. And I always have a little discount on there for my patients, of course. So be sure to check that out, because I have a special section, if you look on there, of the pain protocol, and all these supplements are listed on there. So you can just go on and pick out the ones you need. So you don't have to be writing all this down, because it's right on the website for you. Okay, number 4, vitamin D. Vitamin D is crucial for calcium absorption and overall bone health. So it is great for inflammation. It has many anti-inflammatory, viral type things. It helps boost your immune system. But remember how we said not to take a lot of calcium? Vitamin D is what you want to take. And the dosing is going to be anywhere between 1,000 to 5,000. Now, vitamin D is one of those things that I recommend you get tested in your blood and start taking the supplements and get retested in 3 months, because everybody absorbs vitamin D a little bit different. In fact, I'm going to talk about a whole webinar next time on vitamin D and a little bit deeper dive and how you dose it. So be sure to check that one out. Magnesium. Magnesium is a natural muscle relaxer, and it's great for nerve function. It reduces cramps and muscle spasms. Now, there's a lot of different types of magnesium, so watch my webinar on all the different types of magnesium to find out more about that. But your dosing is going to be between 300 to 400 milligrams a day. If you're taking magnesium oxide, that's a great one, because you're not going to get the bowel effect. Magnesium citrate, however, is great for headaches. But if you take too much, you could be running to the bathroom a little bit, if you know what I mean. Number 6, turmeric and curcumin. Now, curcumin is the active ingredient in turmeric, right? And it's a natural anti-inflammatory, and it helps reduce joint pain and inflammation. It helps reduce pain altogether. You know, some people take aspirin or Tylenol, ibuprofen. Turmeric is a great substitute for that. You can take 500 to 1,500 milligrams of curcumin extract per day, and you can take it 1 to 3 times a day. This is a great one. Boswellia. Boswellia is one of my favorites as well. And it's an herb and it has anti-inflammatory properties. Sometimes people use it topically. You know, you have a spasm, you can put it on topically, but it's also good orally, and it's recommended for conditions like osteoarthritis. The dosing is going to be 300 to 600 milligrams taken 1 to 3 times a day. Number 8, collagen. We all think of collagen like for our skin and beauty and anti-aging and all of that, but collagen is great to support connective tissue and joint health, and it helps reduce joint pain because it keeps those joints nice and lubricated. A common dose of the collagen is going to be 2.5 grams to 10 grams daily. Remember to check out those supplements on my website that I told you about, because you'll be able to see the different brands that I recommend, and it has these dosings. Proteolytic enzymes, number 9. These enzymes, such as bromelain and papain, they reduce inflammation as well and promote tissue healing. The dosing is going to be between 500 to 2,000 milligrams, taken 2 to 3 times a day. I know I'm telling you lots of different things, but I want to pick out the things that are going to work for you. So you got lots of options. MSM. You can take this alone, or you can take it in combination. There are some supplements that combine the glucosamine and chondroitin, remember number 1, with MSM. And it is a sulfur compound, and it helps reduce pain and inflammation like osteoarthritis. If you do have a sulfur allergy, I don't recommend you take it. So the dosing ranges from 1,000 milligrams to 3,000 milligrams per day. Number 11, B complex vitamins. B complex are super important for your nervous system, neuropathy, muscle health. This is a great one. And if getting an overall good B complex, the doses are going to vary. So I've recommended one for you on my site, and you can follow the directions on the bottles. Number 12, this is our last one, vitamin C. Vitamin C is super important for collagen production and connective tissue health. We always think of it as like, if you get a cold or flu, take vitamin C, but it's great for other things too. The dosing is going to be between 500 to 2,000 milligrams per day or more, up to 6,000 milligrams. If you take too much, you're going to run to the bathroom. So I suggest starting out with a lower dose and gradually ramping up to bowel tolerance over time. And so you got a good start. You know 12 different supplements you can use for pain and inflammation and musculoskeletal problems. Check out the online store at drjuliemclaughlin.com/supplements and take your next step. If you want to get some blood tests done and really know what you need specifically, drop me a message and I'll be happy to get you set up, and we'll take a look at those labs so we know specifically what your needs are. Have a great day. My contact information is beginwithwellness.com, and my phone number is 847-565-2346. That's it, and have a great day. I'll talk to you soon. Bye-bye.